Hello guys, welcome to my channel. This is L series with Dr. Ataria. I'm so happy to be with you guys today. Today we're going to be talking about a very interesting topic. It's called bacterial vaginosis, commonly known as PV. PV is the most common vaginal infection of women in reproductive age group. Commonly occurs in 1 out of 3 women. So if there are 3 women in a room, one would have bacterial vaginosis in their lifetime before dying. So you see how common it is. Well, bacterial vaginosis is not a sexually transmitted infection between a man and a woman who have sex, but it can be transmitted from one woman to another woman, that's lesbians who have sex with each other. So if you have a partner that has bacterial vaginosis, you should also treat yourself. Now, what causes bacterial vaginosis? Bacterial vaginosis is caused by a bacterial overgrowth called Trichomonas Gardnerella vaginalis. Gardnerella vaginalis is a normal bacteria found in the vagina, but if there's anything that occurs in the body that causes an overgrowth of this bacteria, it presents with the signs and symptoms of bacterial vaginosis. So, what causes it? Now, there are many risk factors out there. Number one, douching. I cannot overemphasize on this douching. It is not encouraged for women to douche because the bacteria cleanses itself. It doesn't need any external agent like soaps or perfumes, whatever. I know some women use perfumes to make the vagina smell nice. It's not necessary. It contributes to disinfection. And also bathing with bubbles, always adding scented soaps to bath and then lying in them can cause a risk for a lady to contact bacterial vaginosis. So it's advised for you to have a shower rather than a bath. New sexual partners or having multiple sexual partners is also a risk for a lady having bacterial vaginosis because one of the reasons is that the semen is alkaline in nature, and having different alkaline entering into your vaginal area can predispose a lady to have bacterial vaginosis. Also, some women who have recurrent bacterial vaginosis commonly have it after menstruation, reason being that the menses is also alkaline in nature. But keep in mind that the vaginal environment has an acidic pH of less than 4.5. Another risk factor for bacterial vaginosis is use of self-prescribed antibiotics. Antibiotics kill the good bacteria in the vagina, leaving room for this bad bacteria, Trichomonas Gardnerella vaginalis, to overgrow. Now, what are the symptoms that a lady who has bacterial vaginosis can present with? She can present with the most common, which is your fishy, smelly odor, fishy vaginal discharge. So if you have a vaginal discharge that smells like fish, everybody eats fish. Well, maybe not everybody, but most people eat fish. So if you have this odor of vaginal discharge coming out from you, it's a pointer that you might be having bacterial vaginosis. Also, not only fishy odor, it can also present with itching, although it's not common. Now, the discharge that the lady may have is grayish white and is very thin. Some also have green discharge, but it's not common. Bacterial vaginosis can be asymptomatic in some women, and it's actually recurrent in some percentage of ladies. Now, what are the complications of bacterial vaginosis? Bacterial vaginosis can complicate pregnancy in the sense that if you're pregnant, you can have premature delivery of your baby. So it's very important to treat it properly so you don't get this complication. It can also predispose ladies to pelvic inflammatory disease like chlamydia. So when you have it, see your doctor for proper treatment. So how do you prevent it? Like I said earlier, do not touch. Do not use vaginal perfumes or scented soaps, or frequently have baths rather than showers. It's not advised. If you must have multiple sexual partners, please use condom. If you're having sex with a lady, make sure she's treated if she presents with the signs and symptoms so you do not contact bacterial vaginosis. How is bacterial vaginosis treated? Easy. First of all, see your doctor. Your doctor will have to diagnose you first before treating you, run some tests, and do some examination. They'll use a cotton wool swab to take a sample from your vagina and run it under a microscopic light to see if it's actually bacterial vaginosis you're having. There's the AMSALS criteria, which gives a trick for medical practitioners to know if you have bacterial vaginosis or not. 3 out of the 4 of these criteria points towards bacterial vaginosis. So what are they? Number 1, a pH of greater than 4.5. 2, a clean homogeneous vaginal discharge, grayish white vaginal discharge. 3, fishy vaginal odor when your discharge is placed into potassium hydroxide. And the last but not the least of the criteria is, presence of clue cells on the microscopic slide. So once 3 out of these 4 has been seen, it's a pointer. So it's treated. The treatment is with oral metronidazole, 500 mg twice daily for 7 days. For ladies that have recurrent bacterial vaginosis, it's advised for the treatment to extend up to 6 months. Recurrent in the sense that within 3 to 12 months, you have more than one bacterial vaginosis, even after properly treated. Now, you can also opt for the topical method of treatment, which is inserting metronidazole creams or clindamycin cream into your vagina at night before sleeping for 5 days. Now, there's this cream called Balance Active Gel. It's very good because it reduces the pH of the bacteria of the vagina to less than 4.5, which gives room for the good bacteria, example, lactobacilli, to grow and not keep the vaginal environment healthy. So you can apply lactobacillus Balance Active Gel into your vagina for also 5 days, once daily for 5 days. It also helps in the treatment. Now, prevent yourself from getting bacterial vaginosis. Prevent your partners from getting bacterial vaginosis because it's not really nice. I've seen ladies who have had this condition ever since they were 18 years. They thought it was normal. It's not normal for you to have that kind of odor or vaginal smell. And they suffered for it for years. The discharge can be very profuse and very irritating. Having sex can also be uncomfortable, as it can be very smelly at times. So get checked if you're having these symptoms. Get treated appropriately. Thank you for being with us. This is Health Series with Dr. Tara. Don't forget to like our page, share our videos, and make your comments of what you think about bacterial vaginosis. Thank you very much for being with us. Bye!